12 common medications that are destroying your liver and you didn't even know. What would happen if your liver suddenly stopped working? Did you know that many common medications could be silently compromising your liver health? And is it possible to prevent this damage before it causes irreversible problems? The liver is an essential organ that works tirelessly to keep our body in balance. It filters toxins, metabolizes nutrients, and regulates several vital functions. However, it is extremely vulnerable to substances we ingest, and many widely used medications can put this organ at risk. Today, you'll discover which medications may be affecting your liver health and how to spot the warning signs before it's too late. Let's get started. 1. Paracetamol, the harmless that can become dangerous. Paracetamol, also known as acetaminophen, is widely used to treat pain and fever. Because it is easily accessible and sold without a prescription, it has become one of the most consumed painkillers worldwide. However, uncontrolled use can cause serious liver damage. This medication, when taken in high doses or for long periods, overloads the liver with toxic metabolites. The body has a limited capacity to neutralize these substances, and excess can lead to acute liver failure. Studies indicate that around a third of cases of liver failure are related to the indiscriminate use of paracetamol. To reduce risks, it is crucial not to exceed the recommended daily dose, which is usually 2 grams. Furthermore, it is important to check the ingredients of other medications, as many contain paracetamol in their composition, inadvertently increasing the amount ingested. In severe cases, symptoms include nausea, abdominal pain, and jaundice. If you notice any signs of discomfort after using acetaminophen, see a doctor immediately. The good news is that, with responsible use, paracetamol can be an ally to alleviate symptoms without compromising your health. But do other common medications pose similar risks? 2. Amoxicillin, the antibiotic that can silently damage your liver. Amoxicillin is one of the most prescribed antibiotics in the world. It is widely used to treat bacterial infections that affect the respiratory tract, ears, and throat, as well as other conditions. However, although it is effective against infections, amoxicillin can be harmful to the liver, especially when combined with clavulanic acid. Medical studies indicate that long-term use of amoxicillin clavulanic acid is associated with a significant risk of hepatotoxicity. Liver damage can include cholestatic hepatitis, hepatocellular damage, and, in extreme cases, cirrhosis. Symptoms of liver problems can appear quickly, usually between 1 and 6 weeks after starting treatment. Some common signs include fatigue, jaundice, abdominal pain, and dark urine. Although most people recover when they stop taking the medication, around 7% of cases can develop into more serious complications, such as cirrhosis or liver failure. To minimize risks, amoxicillin should only be used under medical prescription and in strictly recommended doses. Additionally, it is essential to perform liver function tests during long-term treatments to monitor liver health. Now that you know the risks, imagine what other widely used medications could be doing to your liver. 3. Diclofenac, the relief that could cost your health. Diclofenac is a non-steroidal anti-inflammatory drug widely used to treat muscle pain and inflammation. Because it is easily accessible and found in over-the-counter versions, many people use it indiscriminately without considering the possible side effects. This medication is especially concerning for liver health. Studies show that diclofenac can cause significant liver damage in just 2 weeks of use. Although the exact relationship between the drug and liver damage is still being investigated, it is known that it can cause direct toxicity, which is dose-dependent, and idiosyncratic toxicity, which is independent of the dose. The most alarming thing is that some people have a genetic predisposition to idiosyncratic reactions, which means that even moderate doses can trigger fulminant hepatitis. The most common symptoms of diclofenac-related liver damage include extreme fatigue, nausea, jaundice, and severe abdominal pain. Because it is difficult to predict who may be susceptible to these effects, the use of this medication should be limited and always monitored by a doctor. If you notice changes in your health status while using diclofenac, discontinue use immediately and seek medical assistance. With so many risks associated with common medications, it is essential to ask, do other seemingly harmless medications also offer hidden dangers? 4. Amiodarone, the heart savior that can attack the liver. Amiodarone is widely used in the treatment of heart problems such as ventricular and supraventricular arrhythmias. Although it is effective in stabilizing the heart rhythm, it carries a high risk of causing liver damage. Research indicates that between 18 and 50% of patients who use amiodarone experience some degree of hepatotoxicity. The effects on the liver can be mild, manifesting as an increase in liver enzymes in the first few days of treatment, or severe, leading to cirrhosis and liver failure in extreme cases. What makes this medication particularly concerning is that symptoms of liver damage can take months to appear. Signs such as fatigue, jaundice, persistent nausea, and abdominal pain may indicate that the liver is being affected. Although stopping treatment usually relieves symptoms, some cases can develop into irreversible complications. If you are taking amiodarone, it is essential to have regular liver function tests to detect problems early. Additionally, maintain an ongoing dialogue with your doctor to adjust your dosage or consider alternatives if necessary. The question that arises is, what other essential medicines can have side effects as serious as this one? 5. Allopurinol, the gout medication that hides a greater risk. Allopurinol is widely used to treat and prevent gout, a condition caused by the accumulation of uric acid in the body. This medication works by reducing the production of uric acid, relieving pain and inflammation associated with the disease. However, allopurinol can cause serious liver damage, even when used in recommended doses. Although these adverse effects are rare, some people are more susceptible due to genetic factors. Liver damage associated with allopurinol includes hepatitis, hepatocellular damage, and cholestasis. Symptoms may include fatigue, nausea, jaundice, and abdominal pain, which may appear both at the beginning of treatment and after months of continuous use. To reduce risks, it is crucial that allopurinol use is closely monitored by a doctor. Regular liver function tests can help detect changes early and prevent serious complications. Additionally, it is important to report any unusual symptoms to your doctor immediately, as this can prevent liver problems from worsening. Allopurinol is an example of how a seemingly safe medication can have unexpected impacts. And if this is true for him, what about other medicines used in continuous treatments? 6. Anticonvulsants, the challenge for your liver in prolonged treatments. Anticonvulsants are essential medications for treating epilepsy and other conditions involving seizures. Although they are essential for controlling these attacks, they can pose a significant challenge to liver health. Medications such as phenytoin, carbamazepine, and lamotrigine have been linked to a wide range of liver damage, which can range from mild inflammation to severe liver failure. The greatest risk arises from prolonged use, which can cause the liver to accumulate toxins, resulting in hepatitis or hepatocellular damage. Research indicates that up to 47% of patients taking carbamazepine may experience changes in liver function. Furthermore, idiosyncratic damages, those that do not depend on the dose, may arise in genetically predisposed people, making adverse effects even more unpredictable. Symptoms such as fatigue, nausea, loss of appetite, abdominal pain, and jaundice may indicate that the liver is being overworked. To minimize risks, it is essential that patients using anticonvulsants undergo regular liver function tests and maintain continuous medical monitoring. If any unusual symptoms are observed, the doctor may adjust the dosage or, in some cases, replace the medication with another that is less aggressive to the liver. Anticonvulsants highlight the importance of monitoring long-term treatments, but can medications used for shorter periods also have devastating effects? 7. Isoniazid, the tuberculosis remedy that can compromise your liver. Isoniazid is one of the main medications used to treat tuberculosis, a serious infectious disease that affects millions of people around the world. Although effective in combating the bacteria that cause tuberculosis, isoniazid presents a significant risk of hepatotoxicity, especially in prolonged treatments. Studies show that liver damage caused by isoniazid can appear in the first week of use, but can also take up to 6 weeks to manifest. The effects range from mild liver inflammation, known as cholestatic hepatitis, to liver failure, which can be fatal in more serious cases. The reaction to the medication is generally idiosyncratic, that is, it depends on the individual sensitivity of each patient. The most common symptoms include jaundice, extreme fatigue, persistent nausea, and dark-colored urine. To reduce risks, it is essential that patients undergoing isoniazid treatment undergo regular liver function tests and strictly follow medical instructions. Furthermore, it is essential to avoid alcohol consumption during treatment, as it can significantly increase the toxicity of the medication. Despite the risks, isoniazid remains a crucial ally in the fight against tuberculosis, but requires care and constant medical monitoring. And if a medicine so common in the treatment of infections can have this impact, imagine what could happen with medicines used for autoimmune diseases. 8. Azathioprine, the companion of autoimmune diseases that needs surveillance. Azathioprine is an immunosuppressive medication widely used in the treatment of autoimmune diseases such as rheumatoid arthritis, Crohn's disease, and autoimmune hepatitis. Although it plays an essential role in controlling these conditions, azathioprine poses important risks to the liver. Its use is associated with several types of liver damage, including dose-dependent hepatotoxicity and idiosyncratic cholestatic reactions, which occur in more sensitive patients. Symptoms of azathioprine-related liver problems include jaundice, fatigue, loss of appetite, and abdominal pain. These complications can arise both at the beginning of treatment and after months of continuous use. Studies show that stopping the medication generally relieves symptoms, but in severe cases, more intensive monitoring may be necessary to avoid major complications. It is crucial that patients taking azathioprine undergo regular liver function tests to detect any early changes. Additionally, talking to your doctor about dosage adjustments or therapeutic alternatives can be an effective strategy for protecting liver health. Although azathioprine is a savior in many cases, its potential impact on the liver reinforces the importance of careful monitoring during treatment. If this is the case for an immunosuppressant, what about medications designed to treat serious conditions like cancer? 9. Methotrexate, fighting serious diseases with a high toll on the liver. Methotrexate is a medication widely used to treat serious conditions, such as some types of cancer, rheumatoid arthritis, and severe psoriasis. Despite its effectiveness, it is known for its significant side effects, especially on the liver. This drug can cause an increase in liver enzymes, which indicates overload on the organ. In prolonged treatments, damage can progress to fibrosis, and in more serious cases, liver cirrhosis. Methotrexate also presents risks of dose-dependent hepatotoxicity, which means that continuous use or in high doses can seriously compromise liver function. Symptoms of liver damage can include persistent nausea, fatigue, jaundice, abdominal pain, and loss of appetite. For these reasons, methotrexate should only be used under close medical supervision, with regular blood tests to monitor liver enzyme levels and general liver health. Furthermore, it is essential to avoid drinking alcohol during treatment, as it can increase the toxic effects of the medication. Although methotrexate is essential in many cases, its potential for liver damage requires care and constant monitoring. If even essential medications for serious conditions can cause these impacts, imagine the risks of treatments for psychiatric disorders. 10. Risperidone and Quepemin, psychological help that impact the liver. Risperidone and Quepemin are medications commonly prescribed to treat psychiatric conditions such as depression, psychotic disorders, and other neurological disorders. Although they are effective in helping to stabilize mood and improve quality of life, these medications can have serious side effects on the liver. Both drugs are associated with drug-induced cholestasis, a condition in which bile, produced by the liver, is not released properly, causing toxins to accumulate in the organ. Symptoms of this problem may include jaundice, dark urine, severe itching, and persistent fatigue. The risk is especially high in patients who use these medications for prolonged periods or in high doses. To reduce the dangers, it is essential that patients undergo regular liver function tests and maintain constant monitoring with their doctors. Additionally, reporting unusual symptoms, such as persistent abdominal pain or changes in skin color, can help detect any liver problems early. Although the impacts on the liver may seem secondary to the mental health benefits, they should not be ignored. The question remains, could lesser-known but widely used medications also pose a significant risk to the liver? 11. Nalide, the easy analgesic that can cost a high cost. Nalide is a popular anti-inflammatory and analgesic widely used to treat muscle pain, fever, and inflammation. Due to its effectiveness and easy access, it has become a common choice for relieving everyday discomforts. However, its uncontrolled or prolonged use can have serious consequences for the liver. Studies indicate that Nalide is associated with a high incidence of hepatotoxicity, with recorded cases of drug-induced hepatitis and even liver failure in patients who use it. Symptoms of liver problems can include fatigue, nausea, abdominal pain, jaundice, and dark urine. The risk of liver damage increases in people with a genetic predisposition or in those who use other medications that put stress on the liver. To avoid these problems, Nalide should only be used under medical supervision, in controlled doses and for short periods. Furthermore, regular liver function tests are recommended to monitor possible changes, especially with repeated treatments. Although it is an effective medication, its potential for liver damage highlights the importance of using it with caution. If even a widely available painkiller can cause such effects, what about tranquilizing medications? 12. Chlorpromazine, the tranquilizer that can cause an alarm in your liver. Chlorpromazine is an antipsychotic medication often prescribed to treat psychiatric disorders such as schizophrenia, severe anxiety, and agitation. Although it is effective in managing severe neurological symptoms, its use can pose significant risks to the liver. This medication is associated with a condition called cholestasis, in which bile produced by the liver is not adequately transported to the gallbladder, causing a buildup of toxins in the organ. Symptoms of cholestasis include jaundice, severe itching, dark urine, and light-colored stools. Furthermore, prolonged use of chlorpromazine can lead to an increase in liver enzymes, indicating liver overload. Although most symptoms disappear after stopping the medication, in severe cases, damage can progress to liver failure. To minimize risks, it is essential that patients being treated with chlorpromazine are closely monitored by their doctors, with regular liver function tests. Additionally, reporting unusual symptoms immediately can prevent major complications. Chlorpromazine is a clear example of how essential medicines can have unexpected adverse effects, highlighting the importance of controlled and monitored use. But is it possible to prevent this damage and protect the liver during treatments? How to avoid hidden dangers in medicines. Preventing liver damage caused by medications requires attention, responsibility, and constant medical monitoring. The first and most important rule is to only take medications prescribed by healthcare professionals. Avoid self-medication or the use of medicines recommended by friends or family, as each body's needs and tolerances are unique. Another essential precaution is to strictly follow the doses and duration of treatment indicated by the doctor. Excessive use of even seemingly harmless medications can overload the liver, increasing the risk of hepatotoxicity. Avoiding combining medications without guidance is also essential, as interactions between substances can increase their toxic effects and make the diagnosis of complications difficult. Additionally, maintain an open dialogue with your doctor about the use of herbal or nutritional supplements. Some supplements may contain substances that increase liver toxicity or interact with prescription medications, worsening side effects. Regular liver function tests are essential to monitor liver health, especially in long-term treatments or with medications known to have liver effects. If symptoms such as jaundice, fatigue, nausea, or abdominal pain appear, seek medical help immediately. Remember, prevention begins with the conscious and informed use of any medication. And if there are already signs of liver damage, how can you identify them and seek early treatment? The silent signs from your liver: how to detect the problem in time. The liver is a resilient organ, capable of withstanding many attacks before showing obvious signs of problems. Therefore, identifying symptoms early is essential to avoid irreversible damage. Among the most common signs that something is not right are persistent fatigue and weakness, which are often confused with other health problems. Jaundice, characterized by yellowing of the skin and eyes, is a clear sign that the liver is overloaded and cannot properly process bile. Other symptoms include nausea, loss of appetite, abdominal pain, dark urine, and pale stools, which may indicate problems with liver function. Unexplained changes in weight, such as rapid weight loss or excessive weight gain, can also be a warning that something is not working properly in the liver. If you are using medications that can cause liver damage, these symptoms should be an immediate reason to see a doctor. Diagnosing liver problems begins with blood tests to assess the levels of liver enzymes, such as ALT and AST, which indicate the organ's overall health. Ultrasounds and CT scans can help identify abnormalities in liver tissue, while biopsies can provide more detailed information about lesions and inflammation. Seeing a doctor as soon as symptoms appear is essential to prevent minor problems from becoming serious conditions, such as liver failure or cirrhosis. Remember, the sooner the signs are detected, the greater the chances of treatment and recovery. With these precautions, you can protect the health of your liver, even in prolonged or complex treatments. Now that you know how to recognize the warning signs, are you ready to take a more conscious and careful approach? Your liver is a true silent hero, working tirelessly to keep your body healthy by filtering toxins and metabolizing essential nutrients. However, like any hero, he also needs care and attention. Medicines that treat important conditions can be powerful allies, but their irresponsible or uninformed use can turn these allies into silent threats. Protecting your liver starts with conscious choices. Always follow medical advice, undergo regular exams, and never underestimate the signals your body sends. Remember that prevention is always the best way. Value your health, look for reliable information, and share what you learned with those you love. Taking care of your liver is taking care of your life. Be the change your body needs and inspire others to do the same. Your health is in your hands. Make smart decisions and allow your liver to continue performing its vital function for years to come. After all, a long and healthy life depends on responsible choices.